Hi, everybody. Welcome to the last Mythbusters, medical Mythbusters of the season until the fall. As you know, this conference is really to re-examine some of the dogmas and things that we've all been heard, taught, and really look at the evidence and see whether these things are really true or myths. So there'll be two 20-minute presentations by two of the R1s, who I'll introduce in a minute. And after that, we'll have a little bit of discussion, and then we'll vote on whether we think that the topics are topic phrase, which will be on the screen, are myths or whether they are true, in fact, true. Let's see. We have no disclosures, no financial conflicts at all. The first topic will be self-explanatory after you see the video. So I guess I'll just launch into the video and it'll become apparent what the topic is, I think. Hopefully you'll be able to hear. Oh. How do I get off of this laser pointer? Oh, there we go. We're not hearing anything. Okay. Why did this work before and now it's not working?
Waiting for you at dinner.
There it is. Hang on a second. I need to back this up. I'm sorry. I think it was on mute. All right, ready? Oh. Why is it?
Start on these Cocoa Puffs, and I'll scramble you some eggs.
I don't like eggs.
If you don't eat for breakfast, they'll be here waiting for you at dinner.
Bye-bye, sweetie. Have a nice day at work. Oh, Joey, you forgot your lunch.
There you go. Hangover?
Heartburn.
What'd you eat for breakfast?
Juice, fruit, milk, eggs, bacon and sausage, hash browns, toast, pancakes, honey rolls, Cocoa Puffs. There's more.
Damn. You must have been starving.
I wasn't hungry too much. My mother's visiting.
Wow. Well, when your mama cooks, she cooks. Mind you, breakfast is supposed to be the most important meal of the day.
Thank you, Tony.
Okay, so our first topic is breakfast is the most important meal of the day. This is kind of a near and dear to me because I don't eat breakfast, and people have told me this my entire life, that I'm somehow, I guess, going to drop dead because I don't eat breakfast, because it is, as we all know, the most important meal of the day. Where the heck did that come from? So our first presentation by Dr. Natalie Gordon is going to be discussing the evidence for or against. Is breakfast the most important meal of the day?
Hello, I'm going to be removing my mask, so I've been able to talk a little bit better. All right, so what Dr. Fried said, breakfast is the most important meal of the day. I'm sure that we've heard this at some point or another, but where exactly did it come from? We actually never really used to eat breakfast, and even dating back to the 16th centuries, only those that had to work a full day actually ended up needing a large meal of breakfast, and they ended up needing to have a breakfast in the morning. It wasn't until Industrial Revolution where we started to have more of a 9-to-5 job, where we started to develop this habit of eating breakfast in the morning. And it wasn't until the 1920s when a man named John Kellogg, sounds familiar, he wanted to develop a more convenient way of eating breakfast. He was actually like an Adventist, and he actually had this sanatorium where it was more of like a wellness complex that he actually housed all of his thoughts on wellness and health. And that's where he actually developed cornflakes. Originally was designed to actually combat sexual desire and masturbation, as he thought it was a sin. But that's where cornflakes was born, and one of the nutritionists that gave a lot of lectures at one of the sanatoriums, Lena Cooper, she wrote an article that first used the phrase, breakfast is the most important meal of the day. And since then, cereal's been really popular, and now it's a 1.4 billion industry, and now it's a regular part of our day. So as we know, with obesity and cardiovascular disease and diabetes, we always tell our patients to eat less and exercise more, and there's been more popularity in looking for other types of dieting, such as intermittent fasting. So a lot of the reasons why I wanted to go through this is seeing if this could be the key. Could this be another tool that we can use for patients? So when talking about intermittent fasting, there's a lot of different types that you can get into, but some of the main ones in my presentation just goes on time restricted feeding. That's kind of similar to what you called 16-8, where you fast for 16 hours a day and you only eat within an 8-hour window. Then there's also alternate day fasting, which is a 24-hour fast where you can actually on the fast day eat around a 500-calorie meal, or the 5-2 diet, which is similar to alternate day fasting, which you fast for about 2 days out of the week. So just to reiterate, what are some of the things that happen when we fast? When you stop eating, your glycogen depletes all of the stores, and your adipocytes break down triglycerides into free fatty acids. The free fatty acids are turned into ketones by the liver, and it's the ketones and the free body acids that actually regulate a lot of expression and activity of different molecules in the cells, and that's actually what specifically promotes a lot of the benefits that you see with intermittent fasting. Some of the benefits, specifically on a cellular level, your cells convert into an adaptive response where they start enacting an increased antioxidant defenses, DNA repair, and also autophagy, where essentially they're recycling a lot of old materials and refurbishing in any other way. This is shown to improve memory, cognition, executive function, and some of the three main things I'm wanting to look into is weight loss, insulin sensitivity, and cholesterol and diabetes, essentially. So these are kind of the main things that I wanted to look at as far as on this lecture. So I'm sure everybody wants to know, does this promote weight loss? Does actually restricting your intake to 8 hours a day, does that by itself actually produce weight loss? So one of the studies I saw was actually recently published in JAMA. It was in 2020 in September. They actually took men and women that all had a BMI of about 27 to 43, and on 12 weeks they wanted to see what happens if they put them on a regular standard structured 3 meals a day versus eating a meal from 12 p.m. to 8 p.m. So the time-restricted feeding, they could only eat between 12 and 8, and outside the fasting hours, they can drink water, tea, or black coffee. They also didn't give any calorie restrictions, and these patients were actually located throughout the United States, and they collected all the data on phone apps and also a Bluetooth scale. And the main research location was in San Francisco, where about 50 patients were able to endure like a metabolic testing. So what they found, patients that actually endured the time-restricting feeding did show a significant reduction in weight loss, lean mass, and appendicularly mass and truncally mass. The other regular eating diet, it did show a decrease in weight and systolic BP, so, which shows if you actually sign up for a study, you're likely to lose weight. But what was more significant was the fact that the time-restricted feeding group did lose more appendicular mass. So in total, the time-restricted feeding, they lost around 2.4 pounds, and the regular eating just lost about 1 pound, but 1.4 of those pounds actually did come from abdominal mass. So their main conclusion from the study is that in absence of other intervention, restricting your intake to just 8 hours by itself doesn't necessarily cause weight loss, but it does show that you're likely to lose a little bit more in your belly than you would have thought. So another way I wanted to look into was actually seeing what if you were actually restricting the calories that you're eating. Does this also help you if you're restricting the time frame and you're restricting the amount of calories that you're eating? Well, there was this meta-analysis that kind of put together about 13 different trials. They all looked at a calorie-restricted diet versus a diet on time-restricted feeding, alternate fasting, or the 5-2 diet. One of the trials that I'll go through is I had different animal trials and human trials. As far as the animal trials, these are mice that they put on either an alternate fasting or a time-restricted feeding diet, and they compared this to mice that had a calorie-restricted diet. Some of the mice in the studies, they duration range from 8 to 20 weeks. Some of them, they actually did induce obesity before actually putting them on the diet, just to kind of compare that to an actual human frame of reference. For the alternate day fasting team, there's a couple studies that did show that the mice had improved fasting glucose, their insulin improved, they also show lower fat mass. And then again, for the mice that endure the time-restricted feeding, it seemed for that group, they also showed increased energy expenditure. And even when they were trying to induce obesity, the mice were actually protected from diet-induced obesity. And also they proposed that some of the mice were able to produce more gut microbiome to protect against metabolic consequences. Essentially, the mice were able to digest carbohydrates a lot better on the diet, and they thought that they were able to have like more gut biome was able to break down some of the foods that they were eating. I thought that was pretty interesting. As far as with the human studies, these are all studies on humans, about like 11 different studies that they talked about, and they did show that as far as like all the characteristics of the human studies, they all had to have a diet that was calorie restricted versus one of the fasting diets. They all had to be at least more than 8 weeks duration, and even on the fed days, it had to have a calorie restriction. And as far as with the patients, they're all essentially physically active. A lot of them are female, and they really varied as far as the types of macronutrients that they ate. But again, with the findings that they had with the fasting diets that they had, whether it's a 2-day, they did show a loss in fat. Alternate day modified fasting did show greater weight loss. And then also with time restricting feeding, seems like those patients were able to maintain a weight loss 1 year later. And then also they did show a significant reduction in weight. As far as the overall conclusion of the studies, only about 2 out of 11 of them did show that there was significant difference in weight and body fat compared to the patients that were on the calorie restricted feeding. And also there wasn't any difference in rate regain. So it does show that most of the other studies still show that they had significant weight loss. So whether you're going to reduce your calories or if you're going to endure an intermittent fasting diet, calorie restricted, there wasn't any significance, and both of them are actually have a lot of efficacy. But I do think when you compare the two, you're going to get a little bit more better metabolic effects with the intermittent fasting diet compared to just a regular calorie restricted diet, and that's more just in regards to fat loss, glucose sensitivity, and insulin. So other than that, some of my next things I was looking forward to is how does this actually help cardiovascular disease? Some of the main things that we try to tell patients to reduce the risk of cardiovascular disease is actually losing weight. So I did want to go a little bit into the pathophys of cardiovascular disease, the fact that it is an inflammatory disease. When you have elevated LDL cells, you have an inflammatory response enacted by monocytes that actually ingest these LDL cells and actually form into foam cells. After that, after forming into form cells, they actually end up releasing cytokines, also promotes a lot of smooth muscle cell migration, and then also having further accumulation in lipids within cells. So not only does having this high levels of lipids, you're also inducing this inflammatory response. Now, with these studies, and this goes whether you're doing the time-restricted feeding, the 5-2, or the alternate day fasting, they all show a reduction in the inflammatory cytokines that are enacted in cardiovascular disease. Not only homocysteine, IL-6, and CRP, adiponectin is the hormone that inhibits expression of adhesion molecules from monocytes. Leptin, it's actually reduces antiplatelet activation, and it also helps with endothelial cell proliferation. And then also restinin also promotes a pro-inflammatory activity of neutrophils and macrophages. So all in all, those three are also enacted in inflammatory response, and they're all shown to be reduced in intermittent fasting diets. Also, they did show we're able to decrease blood pressure through the action of BDNF. That stands for brain-derived neurotrophic factor. They show that this was due to effective increasing parasympathetic activity, and that's also another cell that's enacted and maybe producing like a protective force over the brain as well. So a lot of really good effects in reducing inflammatory response and preventing the promotion of cardiovascular disease. So lastly, another thing I was interested is as far as effects on diabetes. I think that's one of the biggest things what we have with our patients is trying to encourage them to lose weight and having a better diet. On the studies that show the effects of intermittent fasting diets, they did see that the primary reason for having this improvement in insulin sensitivity is due to the fact that they're having decreased apoptosis of B cells. There's also been shown to have an increased mass of pancreatic islet B cells, and also overall just an autophagy of the pancreatic islet cells. And they saw that this process was enacted through activation of protein neurogenin 3. That seems to be a key role in the regeneration of more pancreatic B cells. And that was something that was shown with a lot of the animal studies. And those studies showed more diets from like the alternate day fasting diets that they saw these effects. And of course, through that, they were able to see improvement in blood glucose and also normalizing blood glucose levels. For the human studies, they were able to look at this from alternate day fasting or the time-restricted feeding diets. They did show a reduction in insulin levels and also improvement in the HOMA index. The HOMA index is actually something that's calculated. It actually lets you know how your patients compare as far as like insulin sensitivity, and they did show that they're able to improve this as well. And of course, overall, just like in the previous studies, they did show reduction in weight, fasting glucose, and overall blood pressure and weight size. So a lot of really good effects that they saw. And finally, this other study that I thought was really interesting. I just wanted to see what would happen if you took a diabetic patient and you actually put them on an intermittent fasting diet, were able to have that be their main choice of treatment. So one study was actually enacted in Canada, really, really tiny study. They only did it on 3 patients. So they took patients that essentially had diabetes for about 10 to 20 years. There were 3 men, and they ranged from 40, 52, and 67, and they were all either on insulin regimen, actually both on insulin only, or they had insulin and also oral diabetic medications. So what they did was they put them on an alternate day fasting diet, which was having them fast every 24 hours. And on the fasting days, they would eat a 500-calorie diet, or they would fast 3 times a week, essentially the diet. And of course, with the results of it, not only did they all improve their A1C, but they all were able to actually come off of their insulin, and only one was able to still take, I think, their diabetic medication, but that actually coming off of the insulin happened within about 5 to 18 days. So it was really quick that they enacted this diet and they were actually able to come off of their insulin. And other than that, they all saw about like a 12 to 18% weight loss. They were all able to decrease their waist circumference. And actually a lot of them, they had 100% compliance during the trial, and they also continued this after the trial. And this was all within about 7 to 11 months. So lots of different studies, lots of different topics, lots of different mechanisms of action. But just to summarize all the findings I found on intermittent fasting, it does engage a metabolic switch that promotes a cellular adaptive response that leads to resilience and development of disease. It can be as effective as calorie restriction for weight loss, and then also seems to be a bit better as far as improving your body fat percentage, reduction of abdominal fat, and also maintenance of weight loss 1 year later. It's also shown to reduce inflammatory adipokines, blood pressure, that can all reduce your risk of developing cardiovascular disease. And then it's also shown to help with diabetes management by improving your insulin sensitivity, glucose tolerance, and also reducing your A1C. Now, of course, with any diet, there are things to consider. Of course, it might be something hard to maintain long term, especially if you're going to do an alternate day fasting or a 5-2 diet. Some of the initial effects that you might have when starting the diet could be dizziness, fatigue, bad mood, maybe having excessive hunger pains. There is this concern of hypoglycemia in patients with diabetes, especially those that are taking sulfonylureas and insulin, so they might need to edit the doses that they're taking, and at least in the initial stages before going on the diet. And then also as far as for elderly, frail adults, pregnant patients, breastfeeding patients, patients that have hormone imbalances, eating disorders, those are underweight, those are kind of the patients I wouldn't necessarily promote doing intermittent fasting. I think I saw a lot of studies that I was interested in, but one thing I would really like to find more studies on time-restricted feeding. A lot of the studies were really small studies and only lasted about a short period of time, so I would be interested to see if there was maybe bigger studies that we could find, and also seeing if there's a way to see what the differences are between gender, and then how does exercise also come into play. So these are my references, and thank you. Any questions? Mm-hmm.
No questions? Stay up here.
Okay.
So, question is it a myth? Breakfast is the most important meal of the day. I think we've seen a lot of evidence that actually you might be better off not eating breakfast, at least metabolically, from a metabolic standpoint. But there's certainly not much, and there are obviously other factors like bad mood and things like that, which some of us are prone to. But but in terms of from a metabolic standpoint, it seems like the bulk of the evidence doesn't show any benefit to eating breakfast, and actually there may be a benefit to skipping breakfast. At least that's my take. Is that your take?
Yeah.
So I think before we vote, I had just a couple of quick slides that I made. So this is Franklin, my lab, a frequent house guest of Dr. Jose. If you've ever owned a lab, you know that they have an insatiable appetite. They just will eat and eat and eat and eat. And he literally does watch me every time we're making food. And we asked him what he thought, and he says, definitely a myth. The most important meal of the day is your next meal. Okay, so let's vote. How many people think that this is true, that breakfast is the most important meal of the day based on the evidence, not your personal anecdotal experience? How many think that it's plausible? How many think it's busted? It's like it's pretty unanimous. It's one abstention. So you just need to tap it.
Okay.